Question number 261. A 25-year-old woman was admitted to medical ward for anorexia after chemotherapy. So nursing diagnosis was imbalanced nutrition less than the body requirements. So related to which of the following is the best way to evaluate the outcome of the nursing care of this patient? So option A, record daily weight. Option B, monitor vital signs accurately. Option C, schedule the meal with the family member. And option D, offer the small portion of favorite food. So option A, record the daily weight is a correct answer. Question number 262. Which of the following types of burn will lead to hypertrophic scar development? So option A, superficial. Option B, superficial partial thickness. Option C, deep partial thickness. And option D, full thickness. So option C, deep partial thickness is correct answer, because hypertrophic scars are raised, firm, red or pink, and often resulting from burn, surgery, or a severe form of acne. Question number 263. A 35-year-old patient was admitted in a medical ward with a confirmed diagnosis of meningococcal infection. So which of the following infection control prevention the nurse should implement here? So option A, droplet precaution. Option B, contact precaution. Option C, airborne precaution. And option D, standard precaution. So option A, droplet precaution is correct answer, because meningococcal disease is a severe, rapidly progressing bacterial infection leading to meningitis or meningococemia. So it mainly transmitted through respiratory tract infection. Question number 264. A 55-year-old woman admitted in the medical unit was diagnosed with community-associated methicillin-resistant Staphylococcus aureus pneumonia. So which of the following will be the recommended medication for this patient? So option A, ampicillin. Option B, gentamicin. Option C, vancomycin. And option D, streptomycin. So option C, vancomycin is correct answer, because vancomycin is the primary and first-line antibiotic for treating the serious MRSA infections. Question number 265. Which one of the following is the reservoir for the pathogen causing hepatitis C? Option A, blood. Option B, bowel. Option C, bladder. And option D, bronchiole. So option A, blood, because hepatitis is blood-borne infection. Question number 266. The semi-follower position is appropriate for the patient with which of the following condition? Option A, syncope. Option B, seizure. Option C, diabetic coma. And option D, chest pain. So option D, chest pain is correct answer. Question number 267. Which of the following is one of the clinical manifestation of hyperkalemia? Option A, tetany. Option B, dysarrhythmia. Option C, choristic sign. And option D, torsive sign. So option B, dysarrhythmia is correct answer. And tetany, choristic and torsive sign, these all are the sign of hypocalcemia. Question number 268. Which of the following is the most appropriate height to place the enema bag? Option A, below bed level. Option B, same as bed level. Option C, 50 cm above the bed level. And option D, 150 cm above the bed level. So option C, 50 cm above the bed level is correct answer. Question number 269. Which of the following pulse volume quality is the strong and doesn't disappear with the moderate pressure? Option A, thready pulse. Option B, absent pulse. Option C, normal pulse. And option D, bounding pulse. So option D, bounding pulse is correct answer. A bounding pulse is a strong, forceful throbbing felt in an artery, often described as the heart pounding or racing. So it signifies the increased blood flow and can seem from the normal activities like exercise or anxiety. Question number 270. What is the term used to describe the status of elevated level of carbon dioxide in the blood? So option A, hypercapnia. Option B, hyperkalemia. Option C, hyponatremia. And option D, hypocalcemia. So option A, hypercapnia is correct answer. Question number 271. A surgical unit nurse assessed a 35-year-old post-appendectomy and identified an abdominal distension with absent vowel sounds. So which of the following intervention is most appropriate? Option A, encourage ambulation. Option B, provide liquid diet as tolerated. Option C, ensure patency of nasogastric tube. And option D, check the surgical site. for signs of infection. So option A, encourage ambulation is correct answer, because early ambulation after surgery is crucial for preventing the serious complication like blood clot, pneumonia, muscle weakness, and improving circulation and bowel function, ultimately leading to shorter hospital stay and faster return to normal activities. Question number 272. What is the main limitation of democratic style of leadership? Option A, it ignored the incompetent personnel. Option B, cannot be used in the emergency situation. Option C, decrease collaboration among the team. And option D, may end up in inappropriate decision making. So option B, cannot be used in the emergency situation, because inability to make a quick decision and delayed action and emergency require a swift command and controlled approach. Question number 273. The nurse is monitoring a patient urine to determine the hydration status. So what urine color would indicate the best hydration? So option A, light yellow. Option B, dark yellow. Option C, light brown. And option D, strong orange. So option A, light yellow is correct answer. Question number 274. Prior to initiating the incentive spirometry, the nurse should first assess which of the following in the patient. So option A, gag reflex. Option B, oxygen saturation level. Option C, alertness. And option D, lung sound. So before initiating the spirometry, so we need to check the alertness. So that's why option C, alertness is correct answer. Question number 275. The nurse is conducting an admission assessment of a client with vitamin B12 deficiency. Which finding reinforces the diagnosis of B12 deficiency? Option A, enlarged spleen. Option B, elevated blood pressure. Option C, bradycardia. And option D, beefy tongue. So option D, beefy tongue is correct answer. Some other symptoms include the extreme fatigue, weakness, pale skin, shortness of breath, and heart palpitation. Question number 276. A client has autoimmune thrombocytopenic purpura. So to determine the client response to treatment, the nurse would monitor option A, platelet count, option B, white blood cell count, option C, potassium level, and option D, partial prothrombin time. So option A, platelet count is correct answer, because it is an autoimmune disorder where the immune system mistakenly destroy the platelets, leading to low platelet count, and also it can elevate the chances of easy bruising. Question number 277. A client with the hemophilia has a nose bleeding, and which nursing action is most appropriate to control the bleeding? Option A, place the client in a sitting position. Option B, administer the acetaminophen. Option C, pinch the soft lower part of the nose. And option D, apply the ice pack to the forehead. So option C, pinch the soft lower part of the nose is correct answer. Question number 278. The client is admitted with left-sided congestive heart failure. In assessing the client for edema, so the nurse should check first option A, feet, option B, neck, option C, hands, and option D, sacrum. So option B, neck is correct answer. Question number 279. The best method of evaluating the amount of peripheral edema is option A, weighing the client daily, option B, measuring the extremity, option C, measuring the intake and output, and option D, checking for pitting. So option B, measuring the extremity is correct answer. Question number 280. The client with dementia is experiencing confusion late in the afternoon and before bedtime. So the nurse is aware that the client is experiencing what is known as option A, chronic fatigue syndrome, option B, normal aging, option C, sundowning, and option D, delusion. So option C, sundowning is correct answer. Thank you.